indications for treatment, what kind of cooling apparatus, is it contact cooling or do you need your air cooling, and then the operating modes that they can function with. So we will start with our contact cooling fibers. Specifically, we're going to talk about the 310. So the 310 stands for the different spot sizes ranging from 3 millimeters to 10 millimeters. There's a Xi telescope digital optical zoom, and this is how you change that spot size. And it has a laser guide with a sapphire cooling plate. This is definitely something that you can lean into, like vein clinics, or someone that just really wants to hone in on treating any kind of vascular lesions without that interest in hair removal. So this is a way of kind of separating those two. And then you don't need to have a chiller necessarily. You can just use that contact cooling, and it does get very cold to make these treatments not only comfortable, but safe. This is primarily, of course, used with the YAG. Because Alex, as we know, is not the best at getting vascular lesions. That's more of a 1064 role. But you can operate this in the long pulse mode, so millisecond, as well as microsecond. So we call that dynamics mode, which is similar to like a laser genesis treatment. Vydence calls it thermal peeling. The maximum energy for dynamics mode is 140 joules and 500 joules for the long pulse, which you will never need to go that high for either treatment. And the pulse width ranges from 200 microseconds to 300 milliseconds. And the frequency in long pulse can go up to 3 hertz. So if you're working on some larger veins, you can do these treatments pretty quickly. And then 20 hertz for dynamics mode. The different spot sizes are 3, 5, 6, 8, and 10 millimeters. And that cooling sapphire window. And then that top hat beam profile, which is again pretty standard. It's just making sure there's no hot spots and constant and consistent delivery of energy. So gold standard for vascular lesions. You can do hair removal with this in like small areas like upper lip or chin, but this is definitely not something that I would grab for hair removal. This is primarily for vascular lesions, but can be used for rosacea, poikiloderma, and onychomycosis. And different indications with each pulse. So long pulses for vascular hair removal can be used for fine lines and wrinkles. Not really my go-to personally. I prefer Pro Deep and dual mode, but has that ability. And then dynamics for thermal peeling, which is similar to laser genesis, rosacea, pores, and onychomycosis. Long pulse is selective photothermolysis, and dynamics is more of an accumulation of heat, which can help stimulate some collagen. Long pulse, as we all know, is aggressive and can be a little uncomfortable. And then dynamics mode is more comfortable as long as you're constantly keeping it in motion. Okay, so I don't know if we run into a lot of onychomycosis, but in the South, people like to wear their flip-flops and sandals, and it has been brought up a surprising amount. And I've heard some horror stories about systemic medications or toenail removal to help clear out fungus that just do not work. Even surgery does not work. And I've seen really good results with using laser instead. And we get about a 50% clearance after 2 sessions. Patients need anywhere from 3 to 8 sessions, depending on the severity of the infection. This is your interface. So very similar to all the hand pieces. Fluence is always top left. Pulse width is bottom left. If there's a cooling plate, it's top right. And then the frequency or repetition rate is the bottom right. You can change from dynamic mode to long pulse by pressing either one of these buttons at the bottom. And if you are in dynamics mode, you can keep track of your shot count down here.
Okay, so dynamic mode is shot count, not kilojoules.
No.
Okay.
Okay. So why we believe our Xi has the 3 pillars for excellent treatments. They're very efficacious. We try to keep comfort in mind either while you're using that sapphire cooling plate or if you're going to use our Siberian. And then we try to make treatments as fast as possible. So the wavelengths for our 1064, so our ZI-YAG, high affinity for hemoglobin and melanin, and much greater penetration and lower affinity for water versus melanin. So 1064 is known for depth and safety because it bypasses the basal layer of the skin, so we're not triggering melanocytes. You can look back on this at a later time. I love this study, which is comparative of treating leg veins with sclerotherapy versus YAG. And you can see on the left, that one is the laser, and on the right is sclerotherapy. And you can see how much quicker and better it cleaned up all of those veins. I often tell people that sclerotherapy is effective, but you definitely have to just have the touch for it, which is not something that you can just teach to everybody. Where laser, I believe that anybody can adapt and pick it up. So I just think it's more provider friendly, and then it does tend to work better than sclerotherapy. And why we like our top hat beam profile, so there's no overheating or undertreated treatment points, better coverage, and it's just safer and more efficient. Some of this gets a little redundant, so I'm going to go through. Contact cooling, pros and cons. That sapphire cooling window gets so cold that you have to kind of turn it down sometimes. So I personally have had treatments with this, and it is very, very comfortable. This is showing you the laser beam guide so that you can help center the vascular lesion. And then I tend to just kind of hold that cooling plate there for a few seconds before firing, just to make sure the epidermis is nice and cool, but don't add pressure. And the parameterization of spot sizes, and this is true for all of these fibers. So the larger the spot size, the deeper it's going to go. So if a vein looks a little bit more superficial, go down in spot size. If it looks deeper, more reticular, then you're going to increase your spot size. And this is basically saying the same thing. So difference of deep lesions are more reticular, superficial lesions are more telangiectasia. Telangiectasia is more common on the face, but I have seen very superficial vessels on the legs. So just be mindful of that when choosing your parameters and spot sizes. And this is just talking about your thermal relaxation time when it comes to different types of veins. And then I personally love, trying to explain to people how to treat leg veins. I like this visual because most people who are either new to lasers have a hard time wrapping their head around the fact that you have to decrease your fluence and increase your pulse width in order to treat a larger, more obvious chromophore. So if you have a blue or purple vein and it's 1 millimeter in diameter or even bigger, your fluence needs to go down and your pulse width needs to go up. So you don't need to hone that pulse width, in order for it to see it. If the target is obvious, the laser will find it, and you definitely don't need high energy when your target is really obvious. Now, if your target is small, or it's like those red veins and they're less than 1 millimeter of diameter, that is when you need to increase your fluence and decrease your pulse width, which throws people off sometimes. So this is a really good visual. I like the teeter-totter of how you have to manipulate your settings in order to get certain kinds of veins. And then it goes a little bit more into detail of like asking yourself, what is the depth? And then what spot size do I use based on that depth? What is the dilation? And then this is more where you're going to hang out with your pulse width. If it's a fine dilation, 10 to 30 milliseconds. If it's more dilated, so greater than 1 millimeter, I would say minimum or no less than 30 milliseconds and up to 60. And then how much chromophore? Is it red or purple or blue? So if it's red, it's harder for the laser to find it. So you need higher energy. If it's purple or blue, then you need lower energy. It's much easier for the laser to see blue or purple. And again, this gets a little redundant. So basically it's just kind of driving that point home. And then veins sometimes look like this. And so you might have to change your parameters on the same vein. So what I like to do is start with the largest part of the vein. Hopefully you get a feeder vessel. And then if you've got smaller areas of the vein, you can adjust your settings to then treat those more effectively. And then efficacy. I think we all know that 1064 works really, really well as long as it's used correctly for different kinds of vascular lesions. I always think this is kind of funny because if someone needed help finding a vein, why would they want it removed? But I think they kind of throw that in there. Application, so always perpendicular to the skin, so try not to, come at it at an angle. Always treat reticular vessels before telangiectasia, so go from bigger vessels in diameter to smaller. And then you can even still use an external cooler in addition to contact cooling if you wanted to. You can pass again, but we don't advise stacking. And I kind of alluded to this yesterday with IPL. You have 3 chances, I think, to get a vein in the same spot. But sometimes I'll fire in one spot, and if I didn't quite get it, I'd try to find another spot of the vein before I can find the setting that I'm going to go with. And I always test. So I always pick a spot of the vein to fire a couple times before I know that I'm in the right parameters. And unfortunately, make sure that your hertz is always set to 1 with when you're training someone, because sometimes the device will automatically set to 3 hertz, which we know is very fast. So if you're using the foot pedal, it's really easy to stack. So make sure you're cognizant of setting it to 1 hertz. So you can see that they're using the Siberian in addition to contact cooling. And you can see that vein just completely disappear. This is one of my favorite treatments to do because it's very satisfying. And again, you don't have to do both, but I think if you want your patient to be extra comfortable and you want to be extra safe, that is the thing that you can do. And then one piece of advice I always get people is, be extremely conservative with long pulse on the face. The settings that are recommended to treat veins on the legs are absolutely not the settings that you should be using on the face. I do not go above, I think 175 millijoules was the highest I've ever gone, or 175 joules on the face. Normally I'm around 100 or 150.
What about spot size? The small spot size is a 3.
3, yeah. So typically on the face, it is telangiectasia, so the 3 is appropriate.
Yeah.
But I have seen reticular on the face too. I've seen some deeper veins. I've seen some really big veins, some really angry, inflamed rosacea skin. And I have used the 5.
Okay, so it's okay to go up.
It is okay, but in terms of energy or fluids, you need to be very conservative and just start conservative and test until you see it. But I've seen so many issues of people literally putting holes.
Yeah, that's why like a 1.5 is typically what I use. I don't like to go bigger, but as long as it's safe to go
Oh yeah,
larger.
the 3 is really,
Okay.
it's really great. It's safe, it's efficient. And again, like your endpoint, most of the time you will see blanching, which is amazing and super fun to see, but sometimes you do see darkening. So it'll go gray, or if it was red, it might turn purple or blue. So any kind of change in that lesion indicates that you reached your endpoint. Contraindication, so pay attention to the skin tone and patients with an active tan. Make sure the skin is clean, remove hair because this can remove hair. So if they're concerned about that, make sure you shave the area first. And then just watch for that clinical endpoint and test. If I can leave you with anything, it's just always test before you settle with your settings. If you need a steroid, you can, but of course we don't want to use that unless it's absolutely necessary, and avoid exposure to the sun for 30 days. This can not necessarily blister, but can scab up a little bit. So follow that protocol. I like a good ointment and just not picking at it. And especially lower limbs take a little bit longer to heal. You can use this for hair removal. This is someone's beard line. and they just wrapped it in plastic because the thing about contact cooling plates is if hair gets on the lens and you keep firing it, it could crack the lens.
We have a diode that has a cooling window like that. Typically, I just have like alcohol and a gauze that I just do
Constantly rubbing it. That's what
Yeah.
I do too. So I'm always like after a couple pulses, wiping it and just making sure. I mean, that is probably the downside of having contact cooling. However, it is very comfortable and there's positives to it, but that is something that you need to be checking, you know, every few pulses to make sure that there's no debris on the lens.
I also see circles of erythema when I use contact plates like that get really, really cold. Do you see that with this one or?
Not necessarily, no. And you, like I said, I always gauge the patient. It doesn't always need to be full, like super high, because I've used it and it is uncomfortable when it gets really, really
Yeah.
hot. Your clinical endpoint for hair removal, so perifollicular erythema or edema, and then carbonization of thicker hair and making sure, you know, adjacent tissues look fine, but some of that redness and erythema is needed and is a good sign. So thermal peeling, so this is that laser genesis that most people are more familiar with. It's the same thing. So we have the same capabilities, just like any of those other standalone devices. And it is very similar protocol. So you have the different spot sizes that you can use depending on how bad you think their condition is. There's times where I've seen rosacea so bad, I know I need to go a little bit deeper. But most of the time, the 3 or 5 is appropriate. And then your fluents will range depending on your spot size. And then I like to operate at like 5 to 10 hertz. If you are at 10 hertz, you're going to have to move faster than this individual. I'm imagining that they're operating at 5 hertz. So if it is 10, you just have to kind of keep shaking it. And I do different patterns. I go up and down, I go side to side, I do circles, I do figure eights, and I keep it changing because if you kind of do the same pattern over and over, you're going to see heat build in the tissue and they're going to feel a little uncomfortable. I also see a little bit of sparking sometimes with this. So if you see that, that's a good thing. But just like I said, keep it moving. And anywhere from 500 to 1,000 shots per quadrant, which is similar to like our Pico protocol yesterday.
The no indication for temperature on the skin.
There's not an indication for temperature. It's more of like I base it the endpoint and then I check in with the patient.
Okay.
And then this is showing how to treat onychomycosis. And this is, I think, around 5 hertz as well. So, and sometimes it's fine, and then all of a sudden it gets really hot. So you might find yourself needing to take breaks, and that's okay. As long as you can get like at least 300 shots. But if you have to stop every 50 shots to kind of give them a few seconds to cool down, that's fine. What I don't want you to do is use a chiller. You're trying to accumulate energy and heat in the tissue in order to help treat the specific indication. But if you're just blowing cold air, then you're kind of offsetting what we're trying to do. This takes anywhere from 2 to 8 sessions. You can do this every 2 weeks to 4 weeks, whatever the patient can make work. So contraindications are, again, it's the pretty obvious ones. So pregnant, nursing, if they've got a flare of any kind of autoimmune, if their skin looks compromised, if there's an infection, wounds or lesions, non-absorbable fillers, photosensitizing medications like antibiotics, and make sure everything's clean. We don't want to use numbing for this necessarily. We don't necessarily need it. And then 1064 is the most dangerous wavelength for eyes. So always make sure that you are taking those precautions as well as the patient. And if there is cold sores or herpes in any area that you're treating, make sure that they're on antivirals. Okay. Moving on to the 818. So that was a lot. So if it starts to get redundant, I'm going to skip through because a lot of these fibers do the same things. But we'll just talk about the difference here. So the 818 is a square spot size, which this is strictly for hair removal. This is for contact cooling hair removal. The square is thought to give you a little bit more surface area so that you're able to do a treatment a little bit faster. And I think sometimes like circles you're going to see gaps no matter how, your overlap. Where squares, you could be a little bit more efficient in not having gapping when you're treating large areas for hair removal. It is the same thing. You have that digital optical zoom, a telescope in the back in order to change your spot size. So you're not having to plug and play different spot sizes here. And you do have a laser guide with contrast so you can see exactly the surface area that you're treating. Same thing, sapphire cooling plate can go up to 4 degrees or down to 4 degrees Celsius. And then the flat frame optical technology here. Okay, so it is long pulse only. You cannot do your thermal peeling or your laser genesis treatment. You cannot treat for onychomycosis, rosacea, none of that. This is strictly for hair removal. Your spot sizes that you have are 8, 10, 12, 14, 16, and 18 millimeters. And your pulse width can go from anywhere from 3 to 300 milliseconds. And your maximum fluence is 130 joules. So gold standard for ablation and phototypes or skin Fitzpatrick's 1 through 5. So if it is the Alexandrite, though, I tend to go to 4 max, but the 1064, I've even done Fit 6 and it's fine. And it does work. But the hair does have to be dark. Same technology, comfort and safety. We just talk a little bit about, the other types of cooling that are out there and why the sapphire window is, more efficient as well as, air cooling. This is what it looks like when you change the spot size. So you just twist the little knob in the back and it will increase or decrease that surface area for treatment. So it's really easy to use and you can see in real time it changing. This is what it looks like on the skin. And this is why they wanted to have a square option because we are just getting that much extra surface area with a square versus a circle. Let's go down here. And this is showing it in action. So you can use a little bit of ultrasound gel for glide. You don't have to. You can do like a stamping technique, or if you like having a little bit of gel, you can use that. They encourage you to use plastic film for hair removal in intimate areas because you cannot autoclave this tip. So you need to wrap it in plastic. And you can see when operating at 3 hertz, you can treat pretty quickly. And this is recommended parameters. And you will get like a clinical reference guide with each fiber that will break down, skin type and recommended parameters for hair removal or leg veins. Contraindications are the same. We like to use aloe or some sort of soothing gel after the treatment and make sure you apply sunscreen in the area. Okay, and that was it for 818. So moving along swiftly to our best seller. I think this one sells the most because it has the best of both worlds. The only thing is you do need to have your chiller. So whether it's our Siberian or Zimmer, any kind of chiller that's on the market, it is required to have an external cooler. We have this tube here that installs to the handpiece where that hooks into your chiller. So, and it does again play nicely with other chillers, maybe not all of them, but at least I know it does with Zimmer. So it will plug in and constantly blow that really cold air right where you're firing. So you don't have to have like an extra set of hands or someone in the room with you in order to treat, even using an external cooler. There are 11 plug and play spot sizes. So this does not have that digital optical zoom lens that you control from the back. This you literally have to kind of interchange with the adapter for cooling. So this operates in long pulse and dynamic mode, and this has the most spot sizes available. So it comes in the kit up to 24 millimeters, but you can request a 26 millimeter. Nobody has because 24 millimeters is pretty large and people are very happy with that, but there is that option that you can request. And again, long pulse dynamic mode, a similar maximum energy is before. The pulse width is the same 200 microseconds to 300 milliseconds. And then you can go up to 3 hertz for long pulse, 20 hertz for dynamics. Those are your different spot sizes. And then it does come with that adapter for your air cooling. This is your gold standard for hair removal for Fitzpatrick's 1 through 6. When it comes to the YAG, for the Alex, you're going to want to not go past a 4. And again, this is going to get a little redundant because we kind of talked about this already with the 310. This is the indications that you have available to treat for long pulse or dynamics mode. And same thing. We like air cooling because if you think about what contact cooling is doing, it's constantly fighting the temperature of the skin. And then if you're using 1064 specifically, it gets very hot. So it is always trying to fight against the skin and the skin getting warmer. And so the thought is it really staying consistently cold the entire treatment? We're not very sure about that. So, but we do know when you have air cooling, it is blowing the same temperature the entire time, no matter how warm the skin is getting. And this is showing that 324 in action, and you do not use gel for this. So it is a little bit of you can glide with it, but more of like a stamping technique with a little bit of glide. You can go very fast, but I think speed depends on your pain tolerance of your patient, especially with 1064, because that's deeper, so you definitely feel a little bit more heat. So if they're feeling a little bit more sensitive, and there's certain areas that are more sensitive than others, so I tend to just maybe slow down a little bit and allow for the air to flow and cool it down before I pick up my speed and continue on. So your spot sizes literally just plug and play. So there's that little notch, so you'll insert and twist until you feel it snap into place, and then to remove, you just pull. When you're storing this, be careful because there's like a little lip that can catch. So when you go to take the handpiece out of the holster, it can catch that tip. And I've sent some like to the ground, flying on the ground before. So be mindful of that and carefully remove from the holster if the handpiece has a tip attached to it. Okay, and then the spot sizes vary for, of course, we're going to use a smaller spot size for the face. The skin is thinner there, and the areas for treatment are smaller versus, on the legs, you can go up to 24 millimeters if you wanted. Same thing, where the endpoint is going to be the same, whether you're using the Alexandrite or the YAG. And contraindications and pre-treatment methods and post-treatment are still the same. So again, we don't wax or tweeze the area. We need to make sure the hair is shaved, and always have razors on hand because people forget, even though you tell them, 20 times the protocol and they have to come in with shaved skin. They'll come in full growth. It happens. Okay, so vascular lesions on the face. Personally, this person I would use IPL on first. Long pulse isn't necessarily something I just always go after telangiectasias on the face. If they're fits 1 through 3, I will try to use my IPL first. If the IPL doesn't seem to get it, if they're a little deeper or stubborn, then I will use my long pulse. But again, I'm very conservative, and you will never go to 300 joules on the face. Again, I've never passed 200 joules on the face. And then very similar protocol, when it comes to that thermal peeling, or as you might know it as laser genesis and onychomycosis. Okay, and as always, there is that guide, that My Practice guide. I'm gonna switch, yeah, I think it's on the other one. I have another PowerPoint to talk about the 515, which is gonna be, give me 1 second here. Okay. So the 515 is the final fiber, and it is a very unique fiber. It stands for 515 LT for laser tightening. The 515 is 5, 10, or 15-second increments. This could be used on the face, neck, chest, or body for laser tightening. It will tighten in real time, so you will see a visible improvement immediately. It's a very similar technique to radio frequency without having to touch the skin, and it takes about 3 minutes to treat as opposed to about 20 minutes with RF. This is one of my favorite fibers. I just think it's a little bit misunderstood, and but I think it's one of those things, as soon as people really understand it and gravitate towards it, it's going to be very popular. So it does have the optical zoom to adjust your spot size, your 5, your 10, or 15 millimeter spot size. And that just depends. Are you treating the face or neck? Or are you treating the abdomen, which is the common areas to treat with this laser tightening. It comes in intense mode, so it is literally a 5, 10, or 15-second pulse, so extremely long pulse. And it does have a dynamics mode as well. So if someone just got this, they could still do laser genesis or thermal peeling and onychomycosis and treatment for poikiloderma rosacea, diffuse redness. So the definition of this, it's continuous delivery of energy until reaching a determined time or quantity of accumulated energy, which is, again, similar to the idea of RF. The pulse time is continuous and it is volumetric heating. So it's for facial laser tightening or body laser tightening. Those are the 3 different spot sizes that you choose from. And it's really the only use for the fiber, aside from, doing that dynamics mode, but you continue moving the applicator over the area, and it's not a temperature gauge, but it's a light gauge. So there is a green, like a yellow, orange, and a red light. And in real time, it is taking the temperature of the skin, and you want to get to about yellow and stay in yellow. And if it ever turns red, then you're getting too hot and you need to kind of move out of that area or give it a break. So it is constantly giving you that feedback. And I believe the lights show up here. So it's green and then a little yellow. Yellow is where you want to be. That's your desired temperature. Red is stop. So it has a low affinity for water. And also this is only available on the YAG. This fiber does not work with the alexandrite. It needs the 1064 wavelength. So the light penetrates deeply into the tissue and is converted into heat. And then again, we're trying to slowly accumulate that heat and temperature in the skin to cause denaturization to stimulate new collagen. And it will immediately give the skin a firmer look. Sustainable denaturization can be achieved through lower temperatures like this or like RF, but you need to make sure it maintains that temperature for a certain amount of time. And this is where I love this, because I used to do a lot of RF and my arm would feel like it's going to fall off because it's just constantly moving. It takes about what was it, 10, 12 minutes to get skin to temperature, and then you need to have it maintained for another like 10 minutes for most modalities out there. But you have the intense mode, and then you do have dynamics mode, and you guys are very familiar with what dynamics mode can do. This is the interface for this intense mode. So your power is measured in watts. Your pulse width is measured in seconds. Here is your AccuSense, so the skin surface temperature. So it is telling you the surface temperature and giving you that feedback. It's nice to have it on the handle also. It's not going to tell you 30 degrees on the handle, but it is going to tell you those lights, because it's hard to keep looking back at the screen and constantly keeping this device in motion at the same time. So you do have the lights on the handpiece itself, but if you position the eye, in where you can see, you will actually be getting the temperature in real time. This is total deliverable energy. You have to do this 15-second pulse 7 times. So you're going to do it, I think, 2 or 3 times until you get to the desired temperature, which is 42 degrees Celsius. That should take about a minute to a minute and a half. 7 15-second intervals, I believe, is what? A minute and a half, another 2 minutes. So you're looking at a total of 3 minutes to do what it takes RF 20 minutes to do. And the way that I keep track, because you're probably thinking like, okay, 7 times, how do I count that? I use my hands. So patients, as we know, like to talk, and I want to interact and talk with them too. So I don't want to just be sitting there counting the whole time. So as I'm treating them, I'll put one pinky down on like the bed, and that's 1. And then I'll do another 15 seconds and I'll put another finger down, and that's 2. So that's just like a little pearl of how I kept track of my 7 different pulses for this treatment. It will have this these two beams that align perfectly, and that is going to tell you how far off the skin you need to be. So if you see two dots, you are too far. And then as you get closer, they will center. And as long as that really bright beam is in the center of that red beam, then you are at an appropriate distance from the skin. So the trick is trying to maintain that distance as you're constantly moving over the area that you're treating. This is an example of a treatment in real time. There. So once they determine their distance, then they start going. And you can see the little lights on the handpiece. All right, now we're yellow, green and yellow. That's a really good place to be. Probably a little bit more time. And you're gonna do that, like I said, probably 2 times to get to temperature, and then 7. Once you're at temperature, it's 7 times. And you can do this. Oh, this is thermal peeling on the face, so this is dynamics mode for rosacea. And you might recognize that guy.
Yes,
That's Antonio. So this is a great treatment for enlarged pores, but of course you don't want to go into the beard line, but this can be done on men. Just be mindful of hair, facial hair. Okay, that is all for the fibers. So we can go and play around with some of them. Okay. That's a lot. I have 2 and that's a lot.
I just got last night, so half of my kids have been throwing up everywhere, and I'm like, for days. This has been since last week. I'm like, I'm so over this. Like, I'm not taking anybody's shit. I am so tired. I'm so covered in puke. I'm just sick of it all.
That's a lot of puke times 4.
I just hope that the other ones don't get it, and that I don't get it.
My family, my dad's family, and my little siblings, they all were sick like that last week.
Oh my gosh.
Oh my God, I'm staying way far away from both of you.
No, they live in Kansas.
Okay.
No interaction.
All the think of, because the 2 kids are 6 share a room, and they sometimes will find like an old sippy or something. I think what they did,
Shared a cup.
yeah, because I also saw Case drinking an old sippy, and I took it away from him. So I think that it was just sour milk that made them sick, and they just keep finding. So I keep finding old sippies in the room, no matter how much I search. They're like behind the bed or
They're sippy cup hoarders.
Okay.
Now, do you want me to demonstrate first or do you just want to go for it?
Up to you.
Well, I can just show you and then we'll find the setting for that. I changed it to the 3mm because you can see it's way more superficial. And I'm going to change it to 20 milliseconds instead of 10 because it's more purple than red.
These ones probably could be 20 or 10.
Yes, they're a little harder to see, or maybe the 5 because they're deeper.
Yeah.
But this one's fun. Okay.
Typically, I start.
Oh, can I have the foot pedal? Can you hand it to me?
Are you based here in the States too?
I'm in Florida. It's so funny. Everyone thinks I'm from Brazil. No, I live in Florida.
That's cool.
Yeah.
Well, do you want Joel?
Joan lives in Orlando, but he's like never home.
Oh, he's always traveling.
He literally just got back from Thailand, Indonesia, Dubai, Russia.
Oh, cool.
The Asia show.
Yeah, IMCAS Asia in Bangkok. Yeah. Okay. So, and sometimes you have to just kind of wipe because it will get a little condensation. But you see the laser guide and you just center the vein right there. So I'm going to pick this little end portion to do my little test spot. And just 1, 2, 3. How's that? It's a little spicy.
Just a little, like.
It definitely darkened. I think I might need a little more energy. So I'll try 125. I'm going to pick the spot above it, just going a little bit higher. 1, 2, 3. Yeah, that was better. I wonder if it will blanch though. I'll do one more spot.
Maybe it's a better. No, it's good.
Yeah, we need a little bit more.
Unless you're asking her, sorry.
Oh, I'm okay. You can leave it because I know you need it a little lower. Oh, I heard a pop. Was that okay?
Yeah.
Okay. So we can see a little bit of fading here. I wonder if I do need to go down to the 10 and a little bit of change, but I want a little bit more. I think I do need to go down to the 10.
What type of imprint are you looking for?
Either blanching or darkening.
So like 2 opposites.
I know. It can happen either way though.
Mm-hmm.
Yeah. So we see the little gap. You see the little gap there? I think that is better. So we had to go up to 150 joules. And I went down to the 10 milliseconds. Do you want a treat?
Yeah.
Okay.
These tiny ones with the 3, and then if I can't. Actually, I feel like I might be just.
I think you can do the whole thing. Just treat the whole thing here. And then we might go to the 5 to treat some of these because they are deeper.
Oh, you want to go over it again?
Yeah, I only did random spots. I didn't do the whole vein.
Okay.
I was just testing it. So then just, yeah, slight overlap, follow the vein. A little bit closer together with your spacing. Good. Oh yeah, see how it's darkening? Some spots are darkening and some spots are blanching. And don't be afraid to leave that cooling on for like a few seconds after, just to keep it from getting too hot. Do you need light?
Yeah.
Here, let me give you a light. There you go.
And I'm just gonna raise the bed. There we go. That's a good light.
You're definitely seeing the reaction in the skin.
Yeah.
Yeah, full skin taut.
Oh, that disappeared.
Thanks.
Disappeared.
Nice. Yeah, try to get some of those, yeah, small ones.
I can cold the tip is.
Makes it more comfortable, right? Is
Okay.
Yes, yes.
that when you heard a little pop and now it's getting darker? Yeah, those ones are all darkening as opposed to blanching.
Oops, sorry.
You can, oh, did you do that one?
I did. I think I
Okay.
could do it again.
And then this little guy right there. Good.
Oh. That's pretty deep.
That's kind of it.
Yeah.
Other side?
3mm for sure.
Yeah, so, oh, do you want to do this one with the
Yeah, I
5?
do.
So let's press home. Fortunately, you have to kind of go through the whole thing again. Guideline mode, vascular lesions, larger, yep, lower limbs. Switch it to 5. No, you have to actually turn the dial. Yep.
Is it
Cool.
70-30? I'm just gonna start.
Yeah.
Just because I don't know the energy very well on this one. I mean, I know what you do, but
It's always a good place to start, and then you can just go up. I mean, the milliseconds is pretty short, but it is deep. So you might even need to go to 6 millimeters.
Picture? I think we forgot to do a picture there. I guess you have video. Right?
yeah.
That's fine.
Sorry. There's no finger trigger,
Oh,
so
gotcha. Yeah.
and I'm not a foot pedal girl. Oh.
It's
A little spicy.
Leave it on her after you fire it for a couple seconds, so that cooling stays on her, and then try to
I feel like I actually could go up.
go up. Yeah, I would go up to 80 or 90. I think it's definitely more energy. Yeah,
Wait.
80 or 90. Yeah,
It's very touchy.
yeah. So perpendicular, fire, and then let it sit for a minute, like 3 seconds. There you go.
Down my pulsation.
Um,
That's better too.
make it shorter.
Yeah.
I would
Okay,
increase
fine.
energy and then I would keep it because it's very blue and very thick. I actually think it needs more depth. I think it needs a 6 millimeter. Oh, I think if you just changed the 6 millimeter, it would have changed.
You don't have to go out every time.
If it suggested 5 or 6, the only time I went out is because I did superficial thin veins and it asked the 3. But if it's 5 or 6, I think you can just switch it to the 6 and it would adjust, just for future reference.
Calibrate.
Yeah, it has to change it now that you're at 6. So go to 6 and then now hit that. Okay. So now it's going deeper. I would maybe go back up to 80 or 90.
I feel like it was good energy, but
I think it just needed a
it
little more.
turned a little bit, but that tail gets a little bit more diffused.
Yeah. Are you ready? Ooh. Well, it's gone now. The tail's good. So then I would do 2 more. Just be careful stacking. Oh, it's gone. Okay. Yeah, that depth is definitely more appropriate now. Go back and hit this one little spot. There you go. Good. And then right at the top there. Perfect. Nice.
Awesome.
Do you have any of these on the other side?
I'm not sure. Let me see.
Can you go ahead and just turn this off or like put it on? It's on standby, right?
Yeah.
I would really let this kind of linger, like after you fire it, let the cooling kind of sit on there for an extra couple seconds. And you know these are going to look a little worse before they get better. Okay. Other side. You can probably do the same settings on that one because it's deep. So, yeah.
Other than that, you don't have any of those.
On this side. Yeah. Great. Just want to put the cooling on there for a second. Well, I'll look for the other veins. Oh, we do have.
Oh, let me treat that.
Yeah, that's back to the. I would do the 5, but maybe at lower energy because the 3 was not as efficient at that other
Yeah.
that other one. Here, I'll make sure you're covered.
So now I have to go out.
Just change it to 5 Where was it? Oh, it was this one. Okay.
So if I changed it and something, it would tell me to go back out to home.
If you needed to go to like 3, then I think it would make you go back. Yeah.
Okay, I'm gonna test on this.
Yeah. Oh yeah, that's gone. Let me see. Yeah, we need to go up a little bit, I think, in energy. The tail did really well, but now it's, I think it needs a little bit more.
I'm trying to slip her.
That's good. Very cool. Oh yeah, look how much better that looks.
Yeah.
I don't think I saw those. I wouldn't really. Oh, this one. It's true.
Oh, right.
Yeah, don't. I think you're pushing on it, so I'll just stretch it for you.
Yeah, I just wanted to see what if that was a line from her jewel.
Oh, that is, yeah.
Yeah, so I just blanched it to check.
Do that tail part. Let's just see how it reacts. Yeah, that part blanched. But you might need to shorten it, I
Yeah,
think, a
that's
little
what I
bit for up here because it's finer. Or you can, if you want to just treat that or adjust it, because I think this is very similar to like this part
Yeah.
here.
Does it go down in 5s or just?
It's 10s.
Well, I mean,
It will let you.
yeah.
It just say okay.
Was it in parameters?
Wait, it was 30, so you went down to 15. So it does go in 5s. So go to 25 or 20. Yeah. So go to 20. So just do that part. Do this one. So that looks better. Nice. That one definitely reacted. And this one's fading.
Yes, a little delayed.
Yeah. Yeah, that one already looks a lot better. Okay.
Okay, we're gonna step out so you can change back into your jeans.
So what do you think of it?
That's good.
Yeah.
Yeah. We could give um the people
Are we still live? brilliant, by the way.
Thanks. I think I maybe had 2 men get their backs, like a series of backs, my whole years working in med spa. I've done more backs working here than I ever did.
You know, I don't want to know who you've done, but is it true that when you get older, you get your hair growing faster?
What?
When you get older, does your hair come in faster?
Kind of the opposite.
Oh, okay.
Like grow in faster?
I'm an old man.
No.
I'm 62.
You're young that much.
Half the kids out there could be mine working here.
So because the energy level went down a little bit, it is allowing you to go 2 hertz.
I thought
Yeah.
we go a little bit lower.
Mm-hmm.
Is this being video?
Yeah,
Yeah, we'll like
Is this to be on LinkedIn? Is this not one of Scott's videos?
it's not a LinkedIn video.
not today, but we don't want that through the red.
I go, I had melanoma.
Yeah, but the red.
Yeah, they do a body scan on me every 6 months. So, but I don't know if that comes off that far.
You had melanoma?
Yep,
Where?
on my face.
Oh my goodness.
Yep, they took about a third of my right cheek and then rebuilt it.
You could never tell.
Yeah, I had a really good practice, but I had laser done for the first time on my face about a year and a half ago because I had like small, like spider veins almost. It just, I mean,
Yeah,
I
trauma.
saw,
Yeah.
and they said that's because when they did it, when the skin healed, it was such a disrupted area,
Yeah.
but it worked.
I mean,
Went
if
down to the U and they did it there.
yeah, if you had just some broken vessels, is what you're left over with
Yeah.
from all of that. That's
Well, I moved out here in '92 when I was single, and we didn't care about sunscreen, and it was right below my goggles line where I skied.
yeah.
And I learned really quickly that we're like ground zero for melanoma in Utah because of high altitude.
You're very high, close to the
Yeah.
sun.
No cloud cover, sun most of the year.
Yeah, and a lot of people think that if they're not laying on a beach, then they don't need sunscreen, even though they're skiing and they're in the sun all day.
Yeah,
I'm worried about your shoulders.
but just,
You're so tan.
and that's just one day.
All right, maybe we do from the shoulder down,
Yeah, that's good.
That's a,
or we can do it, but we could change his fits to a 4 to go up there.
Just go
Yeah, there.
down.
and that's one thing that I didn't understand until I actually got in a conversation the other day that laser hair removal is a dead industry almost in the summer because of people tanning.
Yeah. Unless it's like for women in more intimate areas that don't necessarily see the sun.
Yeah.
I feel like typically in the summer, I use YAG a lot more.
Yeah.
But also, especially if I'm doing a large area, sometimes it's 8 weeks before I see them, so I'm not doing as many treatments in the summer anyway. But it definitely does. Slow
Is that
down.
Taylor back there?
Who?
Oh no, I thought the guy who's doing the camera.
Pierce.
Pierce?
Oh, okay.
I don't know. It's either.
I thought we had a Taylor here for a little while.
Do you have another razor?
Do we have another
No.
razor?
Rednecks?
Well,
Did I go?
well, those razors don't last very long.
No, I know they're
You would know they're not very good. Just like all down here.
so I didn't know I didn't know if it was better because I didn't know if you need to see it there.
It's good for us to see it.
Yeah.
It's not a bad thing. Oh yeah,
They're
more's
using
getting
a lint
picked up.
roller on me. Yeah.
Yeah, isn't that smart though?
Yes,
Instead
it
of
is.
having
I'm just
hair
like-
go everywhere. I think that's brilliant.
If my kids saw this, they say, "Jesus, Dad."
And then down here, it's like kind of accumulated. Yeah. Okay, that looks better.
And your name is
I'm Robin.
Robin? Okay.
I see a teeny tiny bit.
It's peroxide.
Alcohol.
How come? That's fine. And Robin, you don't work for us, do you?
I do not.
Okay.
I work for Vydence.
Oh, okay.
Yeah. I'm the
Those guys are they're great guys.
yes.
Where are you staying? Where are y'all staying in town?
I'm staying at the Sheridan in Park City. They I think accidentally booked a hotel in Salt Lake. So they're a little further, but I'm
You
not
live on Main
exactly.
Street?
Is Edge Steakhouse on Main Street? We went to Edge last night for dinner.
No.
That would look like at a ski resort looking thing.
Oh, it's over. It's got to be at the canyons.
Yes, it was the canyons.
Okay.
Yes.
So you'll just have to, yeah. And then you have your goggles.
Yes, ma'am.
Where's my?
Now you need to go to like the No Name bar one night. Well, when do you leave tomorrow?
Tomorrow, yes.
On Main Street.
I feel like I've heard of No Name Bar before.
It's they got a rooftop deck.
Hold on, Steve. I'm gonna give little goggles.
Oh. Yeah. Yeah. Whatever it comes with is good.
Are you live streaming all of this whole time?
Not all of it. Not
Okay.
all of it.
Okay. So we have a little downtime.
Go on the pause.
Where do you normally live?
I live in Florida.
Where?
It's called Ormond Beach. And then I'll turn the cooling on for you.
So I do 20% overlap.
That should be fine. I would say just
Remember that it's like a popping sound I heard. Like bam, bam, bam.
It might take me a while to get used to the foot pedal because I'm not a foot pedal girl.
do you want to turn it down to 1 hertz?
No, obviously.
Takes about 30 seconds of running for it to get really cold. But yeah. Do you need light again?
I'm gonna do.
Is that like a? That's that the dimmer?
It's a Siberian. Oh, I saw a little bit of sparking.
How's that feel, Steve? Okay.
Yeah, fine.
I smell it. It's a little pink.
You're happy with it?
Yeah. I'm gonna go.
Oh my God, that's fast.
How does it feel with the air cooling? Like pretty comfortable or
Didn't bother me at all.
good?
Do you feel like the distance weight is getting warmer? This part.
Do I feel it?
You when I glide.
I don't feel it getting warmer now. every once in a while, one of the clips is like a small bug bite. So like, but that's it. We just pitched this device. Mary did over the phone with me. Is this the ad?
This is the Alex.
Yeah. Oh, it's getting a little bit there.
Feeling it a little bit
Yeah, a
there.
little bit. That's all right. That just felt a little bit more. That's okay.
I'll-
I felt
That row.
that really just I felt a little bit more.
I just turned it up all the way now. She's halfway done.
I know. I can feel it. It definitely gets more sensitive the farther down my back it goes.
Interesting.
Oh, I can smell that.
Three-quarters of the way done.
It's freaking so much faster when I get the candela on me.
The Candela was faster.
This is faster.
This
Way
is faster.
It's not even close.
Can you do laser hair removal over top screws? Oh, interesting.
No, you have to do the laser hair removal first before you get a full sleeve.
We're done?
Yeah.
Even so fast.
Oh, do you want me to keep the air on?
Yeah.
Okay.
So I have to have, like you said, Kiki, like
You can
well,
disengage it and then you'll be able to blow a little bit more broadly.
yeah, it just looks like a little sunburn on my back right now.
It's kind
So, Kiki, what do you think? Like 12, 10 treatments, you said?
Yeah,
Okay.
pretty.
Is that once a month?
No, I would treat you every 8 weeks.
Okay.
You can take these off now.
Okay.
you can definitely see where he's tanner.
Yeah, I'm glad I didn't because how red that.
Yeah.
So, how do you handle, let me ask a question, African American patients?
Use a YAG instead of a Alex.
Okay. Because their hair is so much coarser.
Coarser, and they have so much melanin in their skin, and that's what the laser is attracted to.
Yeah. Because, like on at Gillette, I mean, the black male shaving was a huge issue because the ingrown hairs
Yes.
coarser, closed under, and it was like, it was how do you address that need? And it was really difficult for our engineers. Hey, Kiki, you get an A. A plus. That was ridiculously.
Good. You said, right?
Yeah.
Cryo is probably my least favorite. Yeah. Oh. We should have left the fiber in that one.
What do you want to treat?
You got some hemangiomas, yeah.
little red dot.
They're like
Okay.
those little red blood blisters
Yeah.
looking things. Oh, this is already going down.
Yeah.
I'm just wondering
What's going down?
your redness.
Oh, I'm not worried. Let me tell you, I'm not worried about that.
24 hours like a sunburn. So just treat it as such. Cold compresses, more aloe. Don't raise your internal core temperature for 24 hours.
No working out?
Nope,
No.
Oh, okay.
not tonight.
Okay.
No friction or anything else. And then tomorrow, no lotion or anything either. Tomorrow you can kind of go back to your normal routine.
Okay.
Don't shave or scrub or exfoliate or anything for at least 3 days.
Let this dry.
Alcohol medicine.
Yep. Just make sure the lens doesn't have any hair on it.
I cannot believe how less painful, I would say, or more comfortable this was than the last time I had it done.
Oh, that's great.
Now, I was down in Florida. I was living down there, so my tan level probably could have been higher.
Which is very risky. You could
Yeah.
have easily gotten
I don't know, I didn't think of her. She talked to me about it the other day. So I ran from the other building. I'm like, I was so off. We're good. That smells good.
Okay.
What?
You're giving me blow drying and it's so hot.
Oh, I didn't know.
Okay. So it's on full blast, right?
Yeah.
Just right there. I mean, I'll test at the lowest setting. Is that Alex just always takes a little bit more time? So sorry. Okay. So just the spot. 1, 2, 3. So got a nice snap, but not necessarily the frosting I'm looking for. So I want a little bit more. Go right in the center there. Better. Might want a little bit more.
Yeah.
That sounds better. You want higher?
I would, yeah.
So
That's
better during, yeah, in those more saturated parts. So stop here, right?
I did this whole little square.
Oh, I can do all of this? Okay. So I can start here. I want more.
Doing okay?
Oh, it's better. Well, maybe a little bit. Just with more. That's good. You doing okay?
Yep.
Is it hurting a little
It's
bit?
actually not bad.
And then go down here.
Yeah. That little horn.
And down
Do
here.
that little thing, yep.
Okay.
Tell me if it's not. I numbed it, but it's okay. Cold air makes a big difference. Yeah. Less numb there.
Great. I'll do this one little spot here. And then you can go faster, but essentially I just kind of pressed and held my foot down and it was 1 hertz. And it was a nice pace to make sure I didn't. And it feels nice and raised. And I like the fact that you can hear more of a snap
Not everything frosted as much as some areas, but
Yeah.
the fact that I still heard the snap every time, I was okay with the energy levels.
Okay. Here's the name. Okay. Thank you.
You're welcome. Thank you.
Yeah.
We can just give him a chair.
Office chair.
Oh my gosh, I'm gonna be comfortable.
She's height challenged.
Yes.
Oh wow. No, that's a. Can you put this part down so we can maybe put it right in front? No, it doesn't. Okay, then maybe just have him sit like right here. So it's like close.
Now the chair works.
All right. You see.
Sit it close to the device.
I don't know why I thought I was push you over here myself, but I did. I literally was about to.
You're gonna take him for a
I
ride?
literally was.
Well, I appreciate that.
Let me see what this one says.
Does it matter?
No.
Green, yellow, black.
It does matter. Those aren't appropriate for this wavelength.
What about this one?
Let me see. No, sir.
Oh, did you already take those ones out?
He needs goggles.
Oh, I have the other 13 in my treatment.
Oh, you took the 1340? What?
There's a pair right there.
That's not it. So many goggles. So you've done this with other devices before? You don't have to put those on yet.
Okay.
Yeah.
I've done. I did the multifracts on my face. I've never had it.
Not on the head. Okay. So it's not painful. You might feel a little warm.
Okay.
And it's not going to look like anything when we're done.
How long do I need to avoid sun exposure?
I think just like a day.
Oh, that's it.
I mean, it's really low energy.
Oh, okay.
We're just trying to increase some blood flow and reduce inflammation, and then it acts as like a drug delivery system.
Okay.
Vydence can advertise, but the doctors themselves can.
So when I do hair restoration, I typically want it on clean hair, but no products.
Clean hair, no product, and it has to be dry.
I moisturize.
Yes. What?
I moisturize it.
What do you
So-
mean? What kind of moisturizer? Like
Oh.
face moisturizer?
Tea tree head and scalp moisturizer.
You can do for the month.
This morning at 7 a.m.
So a little alcohol and just make sure the alcohol is completely dry. The tea tree is not irritating to your scalp?
I love it.
And I'm assuming we're just gonna treat this area.
And we'll go to the front too. So
but
front,
not this part.
so you need to isolate and get as much scalp as you possibly can. This is a treatment for the scalp, not for hair. It should not break hair.
Oh, this one doesn't.
It does not break hair. The only time I've seen issues is if someone has really bad psoriasis, dandruff, scabbing from itching or scratching. You don't want to do this treatment. The skin needs to be intact. And then I had an issue with someone who was doing this on someone with wet hair, and then they burn the hair because the chromophore is water. So
Burn my hair.
No, I didn't. Did you do the consent I sent you this morning?
Huh?
Did you do the consent form I sent you this morning? Yeah.
You have my consent.
Finger part. Okay.
Start talking about burning hair, and you're like, oh, I better hurry and get the consent form.
that's if you don't follow protocol. So
Just follow protocol. Keep
I
me
always follow protocol.
hair clean and dry, no problem. So if this was a female patient, and what we see more commonly with females are widening part lines, then you would maybe need an extra pair of hands, or just you have to spread and isolate and hold the hair down and try to get as much scalp as possible when you're doing your passes. But when we have a male patient, we have generally area back here and in front. It's just different from male to female for hair loss. But if you are dealing with hair, you just have to make sure you move as much as you can out of the way. I'll show you like the first 2 passes, and then I'll turn it over to you. Okay, I'm gonna do a little test spot so you kind of have an idea of what it's gonna feel like.
Okay.
So 1, 2, 3. How was that?
And put them in-
You didn't feel anything? Yeah. So I just keep my foot on the pedal, and overlapping is okay. And then when I get to the end of the row, I immediately go back and do it again.
We don't use air for this.
Nope.
Okay.
Because the energy is so low, it should only feel a little warm. And then I go and do 2 passes. And then maybe back here, we'll go horizontal. Okay, so I just did here. So out over on this side is all you, I'm gonna move out of the way so you can stand here.
Nice.
So you're good. I would hold it like a gun if you're feeling a little awkward.
This is the full pedal.
Good. And just do it again. You're not going to see a whole lot.
Go right back over.
Right back over, starting in the back. So don't just like go back and forth like that.
Then you're gonna start and fold.
Yes. Good. And then just do the whole rest of it just like that. Like I said, overlapping is okay. I would go back and do that row again that you just did. Okay. And then if he needs to maybe like turn a little bit towards you so you can get a better angle.
You get one more in there.
Mm-hmm. And then if you just want to do like in this area,
Teacher. Turn toward me.
and then here. And the setting we use today is 10 millijoules with 10 milliseconds, and that's like the universal setting for this.
Never need to increase.
Nope. And that's it.
Done?
You're done.
Ah.
Quick and painless, right?